Hello, my name is Anthony, one of the authors on this paper, and on behalf of my co-authors and partners, it's an honor for me to present our work, an exploration of designing for peer-led critical pedagogies to enable transformative political support for home care workers in the context of computer-mediated support programs. This project was developed with home care workers, or HCWs, in New York City, and in partnership with 1199 SIU, a union representing HCWs. HCWs are essential healthcare providers that work directly in patients' own homes rather than in a clinic or healthcare facility. They provide care for a wide variety of patient conditions, including post-acute and long-term rehabilitation, assisted living, and hospice care. And as a result, HCWs serve some of the most health vulnerable patient populations, and because they spend a significant amount of time in the home, can build exceptionally close relationships with their patients. However, the fact that patients' home is their workplace setting can isolate HCWs and create unique political support needs. HCWs are often vulnerable to exploitation and abuse, such as facing racial bias, sexual harassment, and being placed in dangerous situations. And HCWs report feeling left to face work and workplace challenges alone, with nurse and administrative support often difficult to reach and slow to respond. Finally, because they rarely work alongside or interact with peers, HCWs have few opportunities to build collective identity and identify shared interests as workers. Pedagogies have long been a way to encourage marginalized groups to explore shared political interests. In this research, we developed a support program for HCWs using several features from a variety of critical traditions. In particular, we adopted a Ferrerian problem-posing approach, where facilitators in the support program encourage participants to reflect on their experiences and build consciousness around shared issues. Taking a page from person-centered therapy and humanistic psychology, facilitators avoided assuming the goals and values of the program's attendees and instead used non-directive support to encourage collaborative discovery of shared goals, values, and identity. To address issues of social justice, facilitators focused on the relational and social orientation of HCW's practices and experiences, such as interaction with patients, doctors, other HCWs, and other parties. And finally, facilitators played a critical role in creating a safe space in the support program, where attendees were afforded the ability to create and tell long-form narratives that reinforce the validity of their experiences. The facilitator has a central role in enacting critical pedagogies. However, many critical traditions assume the facilitator is a professional educator, therapist, or clergy, and this is often not true, particularly in computer-mediated support groups. Thus, in this research, we were interested in whether minimally trained peers can effectively perform the role of critical pedagogists. What challenges do HCWs face in the dual role of peer and facilitator, and how does this affect their ability to deliver a support program based in critical pedagogy? What implications does the findings of this research reveal for designing around a technology-enabled and peer-led pursuit of political support and social transformation? We explored these research questions in the context of an online support program that we ran in 2021 during the COVID-19 pandemic. With the help of our partners at 1199 SEIU, in April, we recruited 6 HCWs to be facilitators. These facilitators all had prior experience as peer instructors, leading classes in a train-the-trainer framework, and thus were familiar with operating video conferencing equipment and delivering a pedagogical program. All facilitators underwent a 3-day training on critical and liberatory facilitation practice, which made use of scenarios on how to handle conflict in a non-directive manner, play acting on how to encourage storytelling and enforce ground rules, and reviewing supplementary resources on addressing abuse and workplace violations. Peer facilitators were paired up, and we created 5 weekly time slots for video conferencing-based support groups, trying to offer various times throughout the week. Simultaneously, we started recruitment on 42 participants who were assigned to particular time slots based on their personal availability, but also keeping groups no larger than 9 members. A second paper published elsewhere focuses on the experiences of these attendees. The 8 weeks of support groups began in May and continued through the first week of July, and at the end of the program, facilitators underwent a group debrief and were individually interviewed about their experiences. This data, alongside researcher observation and notes, and smaller facilitator debriefs throughout the program, inform our findings. There are multiple findings in this work, but I want to emphasize 2 critical ones around the implication of peer facilitators' dual positionality in a critical pedagogy. The first is that peer facilitators leverage this positionality to better connect with and represent the interests of attendees and create a collectively owned space in the support program. In this quote from an attendee, we see how the support group members valued the fact that facilitators were not teachers, but instead had real on-the-ground experiences as HCWs, which increased the sense of rapport and confidence they had in peer facilitators. Facilitators also helped connect participants to outside resources and leveraged their own contacts in the union and other professional contexts on behalf of participants to help address ongoing workplace issues. A second consequence of their dual positionality was that peer facilitators had to unlearn expectations that came from their more familiar roles as instructors or senior HCWs who may interact more prescriptively with peers. We had recruited HCWs with experience as instructors to be our facilitators, but a significant difference between instruction and the support program was a lack of a correct answer. While instructors are expected to present canonical information to students, facilitators did not have answers and did not hold a position of authority based on their control of answers. The support groups were not spaces for facilitators to present their knowledge or experiences, but instead, as described in this quote, to rein themselves in and encourage participants to speak. It was through listening that facilitators enabled the types of support that participants needed. This difference in approach also had implications for how peer facilitators handled conflicts, which occurred around differences of opinion on appropriate practice. Rather than resolving the conflict by deferring to a canonical answer, peer facilitators reminded participants of the validity and unique contextual embeddings of each other's experiences. Finally, as our peer facilitators were paired up, one strategy to better manage this difference in expectations was to split the role of experienced peer and the role of a non-directive facilitator with their partner, with pair facilitators often switching off these roles between sessions. Discuss how our findings inform how technology could be designed to support peer-led critical pedagogies in future computer-mediated support programs. For example, our peer facilitators often needed to coordinate with their co-facilitation partner. And coordination can be easier in in-person support groups as facilitators can meet in the room before and after a session, as availability of the space is less strictly time-bound. Some facilitator pairs took the initiative to exchange contact information and coordinate using external tools, but having integrated affordances for back-channel and side-channel communication could encourage better coordination between facilitators and make them more effective. Secondly, we found that because the video conferencing environment transmitted fewer body language cues, it was more challenging for facilitators to judge attendee engagement and whether anyone wished to speak. This was particularly difficult when facilitators used their phones to moderate sessions and were faced with tracking who had spoken when not all participants were visible on the screen. And finally, sharing persistent information such as the topic of the day or ground rules was essential for tone setting and encouraging participation, and technological affordances could be designed to aid these processes, especially for attendees connecting via basic phone call. Notice the need around training peer facilitators to handle the challenges of their dual role. This might include additional training on balancing the power dynamics of being a facilitator while still capturing the experiential and relational benefits of being a peer. This training could include scenarios, case studies, and role play around how to handle conflict to encourage contradictory viewpoints from participants without undermining facilitators' leadership role within the program. Finally, more training on how to encourage participation, particularly for shy and novice storytellers, through follow-up questions would also help peer facilitators be more effective. However, we also recognize that a purely non-directive facilitation practice may never be applicable or even desirable in the context of peer-led critical methods. We conducted a 3-month peer-led online support program and using facilitation methods inspired by various critical and liberatory pedagogical traditions. We found that peer leadership brought many benefits to the program, such as helping create an authentic ownership of the space with other HCWs and providing a go-between that understood and advocated for participants' needs, but also introduced challenges as facilitators reconciled their experiences as peers and prior familiarity with more classical instructive roles with new non-directive methods. Some opportunities for future work include better support for peer leadership through the design of technological tools and online spaces, and improved training focused on the different expectations of critical pedagogies. We also recognize that many critical and liberatory traditions have important non-compatible differences, and so this is only the first step in exploring how these methods might be implemented in peer-led online support programs, and future work could explore what those differences might be and how they could manifest. And finally, while we worked with home care workers, many of the challenges we tried to address throughout this program are also felt by other populations of exploited, isolated, and distributed workers. An approach focused on supporting political needs rather than simply informational and emotional needs is an area of continuing scholarship. More details on our methods, discussion on peer-led critical pedagogies and its inherent tensions, and design of the support program and discussion of relevant literature is in the full paper. I want to acknowledge and thank our partners at 1199 SIU Training and Employment Funds, the HCWs that were facilitators and participants, and our funders that made this project possible. Thank you so much for your time.